Good afternoon. Today is Tuesday, February 16th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. My guest again today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. First of all, I want to share some very encouraging trends that show we are making good progress against COVID-19 in our county. For the first time in months, Oswego County's 7-day positivity rate for COVID testing is 1.8%. That is the lowest that has been since the beginning of November. As of this past Friday, a total of 16,093 county residents had received the COVID vaccine. It's higher today because several hundred more people received their vaccines over the weekend. The current statewide average of residents who have received their first dose of the vaccine is 9.25%. Here in Oswego County, it's 10.54%. This week, we also expect to receive a limited amount of vaccine to begin vaccinating those with eligible underlying health conditions. The final details will be based on the amount of vaccine we receive and will be announced on the county website. The Oswego County Health Department can't do all of this by themselves. None of this would be possible without the support of our community partners. The school districts who allow the County Health Department to use their facilities for mass vaccine clinics, medical professionals, other Department of County government, and countless volunteers who help at the vaccination clinics. Oswego Health, Urgent Care, Connects Care, and others who are immunizing per the state guidelines. The pharmacies who are responsible for vaccinating people age 65 and older, and many others in the community who donate food, services, and time to support these efforts. On the county government side, the county has spent almost $100,000 since the beginning of January on COVID-related expenses in various departments. This money is used for personal protective equipment and supplies for county and local response agencies and COVID expenses in various departments such as health, public information, emergency management, sheriff, buildings and grounds, technology for remote work and meetings, and isolation and quarantine expenses. Last week, the legislature approved transferring $200,000 from the unappropriated fund balance to the COVID response account to cover COVID expenses. The county has submitted a claim to the Federal Emergency Management Agency for just under $500,000 for previous COVID-related expenses. The claim is under review by FEMA, and we're working on a second claim now. Our health department continues to vaccinate the Phase 1B population as required by New York State. These priority groups include first responders, school personnel, child care providers, public-facing grocery store workers, developmentally disabled, restaurant employees and delivery workers, and taxi drivers. Although case reports continue to decline, I'm sorry to say that we now have 88 deaths in our community related to COVID-19. On behalf of the Oswego County Legislature, I once again extend our sympathy to their families and loved ones. We must continue to be proactive about our preventative measures to protect ourselves and our loved ones. And now I invite Diane to give the Health Department's report.
Thank you, Chairman Weatherup. Our 7-day cumulative new case counts continue to decrease from 321 on February 1st to 173 on February 8th and 149 as of yesterday. Again, this is welcome news, but all of us need to continue our safety measures, including masking, frequent hand washing, and social distancing until the community's herd immunity is established. As of this afternoon, we have total active positive cases 167, total tests 143,729, total cumulative positive cases 6,111, total negative results 135,530, total patients released from isolation 5,856, deaths reported by New York State Department of Health 88, Total quarantined or on mandatory isolation, 462. Total number of vaccinated by County Health Department, 3,929 as of this afternoon. This includes 2,627 first dose vaccines and 1,302 second dose vaccines. Last week, the governor announced that people with certain pre-existing conditions will be able to get vaccinated at state-run mass vaccination clinics, such as the one at the State Fairgrounds in Syracuse. As Chairman Weatherup mentioned, we are still working on meeting the needs of the Phase 1B population, including restaurant workers and for-hire drivers. We will also begin vaccinating those with eligible underlying health conditions. We are expecting to receive a limited amount of vaccine to start vaccinating this population. Those registering will need to bring with them a letter from their healthcare provider stating they meet the eligibility requirements under this phase. Everyone should go through the New York State MI-Eligible website to determine if they are eligible. Everyone needs to show proof of eligibility, such as a work ID, pay stub, or a statement from a healthcare provider. Those without proof of eligibility will not be vaccinated. Pharmacies are receiving vaccine this week as well, and those over age 65 should seek vaccine through the pharmacies. We will post a link to register for this week's first dose COVID-19 vaccination clinic on the Health Department website today or tomorrow. It's important to also remember that the two types of vaccine which are currently available, Moderna and Pfizer-BioNTech, are not interchangeable. Those who receive the Moderna vaccine must receive their second dose of Moderna 4 weeks later. Those who receive Pfizer vaccine must receive their second dose 3 weeks later. Vaccine providers will schedule the second dose appointment for the recipient when they receive their first vaccine. I also want to let you know that the County Health Department has partnered with Pulaski Urgent Care to arrange for free COVID-19 rapid testing next Tuesday in Hannibal. Pulaski Urgent Care will bring their mobile testing unit and provide COVID tests at a drive-through clinic from 8 a.m. to 4 p.m. at Hannibal High School. Appointments are required in advance. To register, follow the link on the Health Department's webpage or call the Health Department's COVID-19 hotline at 315-349-3330. The hotline is open weekdays from 8:30 a.m. to 4 p.m. and from 9 a.m. to 1 p.m. on Saturdays. Those being tested should wear a mask to the clinic, arrive on time, and remain in their vehicle until they have received their test results. The February 16th clinic that was scheduled for today in Oswego was postponed due to weather. It will be rescheduled. Those who were registered will need to sign up for a new appointment. Thank you.
Thank you, Diane. People who need rides to testing and vaccination appointments may call 315-598-1514. Transportation is available weekdays between 6 a.m. and 7 p.m. Appointments for rides should be made in advance. We continue to see high demand for the COVID-19 vaccine in Oswego County, and we appreciate everyone's patience. The County Health Department will continue to increase testing, trace close contacts, and vaccinate as vaccine becomes available. Thank you for your patience, for doing your part to prevent the spread of COVID-19. Stay safe on the roads. Continue to maintain safe behaviors, including hand washing, face masking, and social distancing.